Hi, hello. So this is Selshia. Today I'll be talking about the physiology of pregnancy. In physiology of pregnancy, I'll be talking about the genital tract changes in pregnancies. When we see the genital tract, it has uterus, cervix, vagina, fallopian tube, ovary and round ligament. So we will see the changes happening in each and everything during pregnancies. Uterus, when we see, uterus undergo change in size, shape, uterine wall and blood vessel position. Not only that, it undergoes changes in its uterine contractibility. So when you see the size of the uterus initially, it will be just of 70 kgs. Later on, at term, the uterus would weigh about 1 kg due to hypertrophy. And not only due to hypertrophy, it can be due to hyperplasia also. Then when you see the centimeter, that is the long is, it will be initially 6.5 centimeter long. At term, due to hypertrophy, the size would be 32 centimeter long and 24 centimeter wide. Later on, when you see the shape initially it will be globular. Later on, it would change into a oval shape. Uterine wall, it will undergo hypertrophy, which would become thicker, and gradually it stretches and it would be of the 1.5 centimeter thick, and it would be very much soft. And when you see the hypertrophy occurs due to the hormone called as estrogen predominantly. The mechanical distension, when you see at 12th week of pregnancy only, the mechanical distension occurs due to the expanding of the product of conceptions. The uterus grows out of the pelvic by about 12 weeks of pregnancy, so that only you can see the mechanical outward distension of the abdomen by about 12 weeks of pregnancies. When you see the arrangement of the muscle fibers in the uterus, the uterus has outer layer, middle layer and inner layer. The main important thing is you should know about the middle layer. Middle layer is of crisscross, and between the crisscross muscle fibers there runs a vessel. So therefore, after delivery, the fiber contracts and constricts, and this avoids bleeding. So therefore the middle layer is known as living ligature of the uterus. The outer layer arches over the fundus, whereas the inner layer is mostly seen as the sphincter fibers over the opening of the fallopian tube. When you see what is Heger's sign, the Heger's sign is nothing but the lower uterine segment will undergo softening and it will undergo stretching, and it is most commonly seen in 6 to 8 weeks of pregnancy. This is usually felt by examining the uterine segment is compressed between the examining fingers. So this is known as Heger's sign. When you see the position, when the patient stands, the long axis of the uterus will be of the axis of the pelvic inlet, whereas when a patient lies down, the patient's abdomen will lie above the spine, aorta and inferior vena cava. Whereas in pregnancy, as the uterus expands, it is moving out of the pelvic cavity and it is becoming an abdominal organ. As we all know before, any abdominal organ is shifted towards the right side due to the particular rectosigmoid which is present on the left side. So we know that the uterus is also dextro-rotated. Uterine blood vessels, we all know hypertrophy occurs, hyperplasia is occurring, therefore there is increasing in the blood vessels like blood, vein and lymphatics. And when you see the uteroplacental blood supply starts to develop, this develops due to increased blood flow because the child in the mother's uterus will require a lot amount of blood for its withdrawal, for it to withstand. Therefore, we need lot amount of blood supply. So which therefore the uteroplacental blood flow is established, which occurs through three steps. One is pre-invasive stage, another is intraluminal stage, another one is wall replacement stage. What happens in pre-invasive stage is nothing but the trophoblast of the uterus invades the endothelium of the spiral arteries. When these spiral arteries enters the endothelium, and next it is intraluminal stage. This trophoblast enters the myometrial spiral arterial walls, and later on this wall was replaced as a fibrinoid material, because of which the wall becomes the spiral arteries become thin walled dilated sinuses, and the uterine blood flow is increased to about 500 to 700 ml at term. Uterine contractibility, if seen during early pregnancies, the woman will have a uterine contraction, and this uterine contraction is called as Braxton's Hicks contraction, which is a painless, irregular, intermittent, and it is for a longer interval, but it will last for a shorter period, and it will not show any coordination, or it will be of diminishing gradient. And when you see this usually occurs in the early pregnancies. Then in the later stage of pregnancies, this will change into a discomfort to the patient, and it can show as a false labor to the patient. Later on, due to increasing the tone and sensitivity during the close of the term, the patients will have a regular and coordinated contraction, which will be said as the true labor pain. Therefore, a true labor pain is a regular and coordinated, whereas false labor pain is will not show any coordination, and it will be of diminishing gradient. And what are the changes that we see in the cervix? A cervix will become soft and blue due to increased vascularity and hypertrophy, and due to the hypertrophy of the cervical glands, due to there will be hypertrophy and increased vascularity occurring. The cervix will become soft and blue, and when you see, there is eversions of the endocervical columnar epithelium, which appears as erosions in the cervix. Erosion in the cervix during pregnancies, and therefore at the time of taking pap smear, the area is soft, velvety and red, and it can lead to bleed also. Secretion is when you see the secretion in the cervical area is increased, and this collect as a plaque in the cervical canal, and during pregnancy, at the time of onset of the labor, it results as a bloody show. The cervical stroma also undergoes lots of changes. It loosens the collagen and hydroxy proline content, and it loosens, and the collagen and hydroxyproline content it decreases, and there is increasing in the water content. This leads to a softening and ripening when the pregnancy is near term. Fallopian tube. Before going to fallopian, let's see about vagina. Vagina increases in vascularity, and we see that there is a very more copious secretion, which is violet discoloration during pregnancy, which is called Chadwick's signs. This vaginal mucosa is very much thick, and there is hypertrophy of smooth muscle cells and the loosening of the connective tissues. These are marked, very important, that is seen during pregnancies. Secretion is also, when you see, it will be much of acidic in nature, and acidic in nature. The increased vascularity at the time of pregnancy is not confined to genitalia, but also extend to the adjacent organs also. And when you see fallopian tube is generally, it is stretched out in a pregnancy, and it is also more vascular, whereas in round ligament, as we all know, it is becoming thickened and hypertrophied. And ovaries, the one with the corpus luteum, it is very much enlarged, and its corpus luteum function, which usually lasts for about 6 to 7 weeks of pregnancies. So these are the changes those are occurring in the genital tract of the genital tract, changes that is occurring in the pregnancy. Thank you for watching. Bye.